you're joining from. This is your favorite doctor in the house, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are highly, highly welcome. All right, so come on, guys. Just invite as many people as you can. Today's topic is so beautiful that we all need to come in and enjoy and learn. Because sometimes when we have medical issues and we start seeking help from people that have no business with medical issues, and then make ourselves a guinea pig for them, they will end up bastardizing your already bad medical condition. So that's why somebody like me have taken it upon myself, being a doctor, to make sure I enlighten my followers and every other person that is on Facebook. Listen, if we continue going to people that cannot solve our medical issues, it means that they will keep on destroying people's health. These people are very malicious and will not even let you know that they don't know what they are doing. When you come, they will take the money from you and cause all the harms and destruction that they can do to your health and to everything that concerns you. So that is why people like me that have this platform have decided and taken it upon myself to enlighten people and to teach them what they might not know so that they learn and do the right thing for their health needs. Okay? So now that you have joined, please kindly share this video so that a lot of people will come in and we all share our life. Listen, if you have already had something like this, some medical issues as what we are going to discuss, feel free. Ask me to add you on the screen and I will add you and you will come to tell your stories. Or if you have actually had issues like this and somebody tricked you to take you to places where you're not supposed to do and they cause a lot of harm to you, feel free to come in here. Here is a platform that is open for everybody. We do not segregate, we do not make people feel bad. Even when you are making mistakes, we will nicely and happily correct you and let you know exactly what it is. That's no show for the stars. I appreciate it. Please listen very attentively. If you have similar medical issue or you have anybody that have this medical issue, you could actually tell the person, oh, I heard this being discussed in my platform. And the person can actually, oh, you even forward the video. Now, before we go in, those on YouTube, those on Facebook, please click on that share button because the more the merrier, okay? All right. Now, before we go on, I have to introduce myself. This is your favorite doctor in the house, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are highly, highly welcome. So today, we are discussing some very, very important medical issue. Do you know what we are discussing? I mentioned it on the uh, 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 introduction of this particular video. We are discussing nothing else but placenta previa. Yes. So guys, have you heard of placenta previa? Type on the comment section, have you ever heard this before? If you have heard it, say yes. If you have never heard it, say no. Type on the comment section and let me know whether you have even heard what placenta previa is. Remember, I say I get my inspiration from what I see on Facebook, okay? There is this page that I watch and I follow. I don't know whether you know about that page. It's Nurse, I've forgotten her name, but she is currently pregnant. She is in Dubai, okay, with her family. She has a son already. And they just told her that she will not be able to deliver the baby vaginally. And she is so, I love the way she's carrying the pregnancy. She is carrying everybody along and telling people that, look, listen, I am going to have my baby via cesarean section. Listen, we in Africa, I don't know from other parts of the country, I don't know this myth that women believe that anybody that has gone through cesarean section did not deliver the baby. It's so sad. Honestly, you would think it is a very simple thing. When I was in Africa, there are a lot of people that had very, very serious medical issues. Why? Because they decided not to do what? Go to their cesarean section. Because some women, in Africa will talk ill about somebody that have gone through cesarean section. Meanwhile, they don't even understand that sometimes cesarean section is even good. Listen, when you do vaginal delivery, your vaginal area is very, very sore. Very, very sore to the point that you might not even be able to have sexual intercourse with your husband for some time until you have healed. Okay? Whereas, if you have a baby through cesarean section, as far as the wound has healed and you're able to mobilize and move about, you can start having sexual intercourse with your significant other or your husband. So I don't understand why people believe that cesarean section is a taboo. I have seen women that a doctor have told that, look, you cannot deliver via vaginal route. Why? Because you have several pelvic disproportion. That's a different thing. What it is that the pelvis will not be able to push out this baby. It's not competent enough to push out this baby. But guess what? You know what these women will do? They will go to their church, they will go to traditional birth attendants, and these people will convince them that they will be able to deliver their babies. And guess what? They end up being bastardized and used as guinea pig, because that is the word that I like using. They use you people as guinea pig, and at the end of the day, these people will end up destroying everything that would have come out easily. The role of OBGY and every doctor that is managing your pregnancy is for the mother and the baby to be alive. They don't want just the mother to be alive. No, they want the baby and the mother to be alive. So when you go to these people that don't know anything jack about medical issue, yeah, definitely there are some pregnancies that is straightforward, okay? The way they say Hebrew women. Yes, there are some pregnancies that when you deliver them, when you go into labor, you're going to deliver your baby without any problem. But just guess what? When you go in there, these people did not do scan, or even if they do scan, they don't even know what your health issue is about. They don't know what placenta previa is. They don't know what anything they are doing is. And then at the end of the day, you end up being used as a guinea pig because they don't know what they are doing. I have seen a woman, a professor, that was told, listen, you have cephalopelvic disproportion. And guess what? This professor have been looking for the fruit of the womb for a long, long time. And the team looked at her and said, look, your pelvis is not competent enough to deliver this baby. Do you know what this lady did? She went to the church, and the church told him that, listen, if you go to the hospital, you will buy. And this lady listened. You know why anybody will blame this lady is if you have never had any medical issue and you don't even have the money, you don't even have the facility, you cannot be able to take care of whatever thing that is happening to you. So this is what happened to this lady, and she actually had these people talk to her, and she believed them. And She went into labor. Despite the hospital have told him, the doctor have told her that you cannot deliver this baby without cesarean section. And when the labor set in, she was in a traditional birth attendant with the church members, and she had what we call shoulder dystocia. The shoulder impacted in her vaginal area, and that stopped the progress of the delivery. She was wheeled into the hospital, and by the time they came, the baby had already died. And this was a 45 or 46-year-old woman that this might be the last pregnancy that she will ever have. And unfortunately, they caused this problem for her, and the baby died, and the hospital and doctors and the team was now battling to even save her. So today, we are talking about placenta previa. Placenta previa, as the name implies, it has something about placenta in it, right? Placenta is an organ that does what? That develops in the uterus, in your womb. When you're pregnant, the baby is forming, the placenta would also develop in the womb. Okay, so you see placenta only when you are pregnant. Any woman that is not pregnant cannot see any placenta in their womb. Okay, now this placenta we are talking about is not anything extraordinary. It is something that provides oxygen and nutrients to the fetus. We call the baby that is in the womb fetus. Why I'm trying to make it very plain like this is for you all to understand what we are talking about. Okay, without the placenta, the baby will not have oxygen, the baby will not have nutrients that will help the baby to grow. Okay, the placenta also removes waste products from the baby's blood. Okay, because the baby cannot defecate. Okay, so the waste products that the baby have will also go out through the blood to the placenta, and then the placenta will find its way to excrete it, and then the mother will now pass it through feces or any other means that she passes. Of course, it's only through feces that you pass your waste products. Okay, now during normal pregnancy, okay, this placenta will attach to the wall of the uterus. So on your womb, that placenta is going to be attached in that womb. If you are a woman right here and you have delivered a baby, comment on the comment section and tell me whether when you delivered the baby and delivered the placenta, did you see your placenta? Say yes or no. Do you know the consistency of the placenta? Do you know how the placenta look like? Some people say the placenta look like the liver, okay? If you have had any pregnancy, comment on the comment section and let me know. Did you see your placenta? Because I know that a lot of people, their placenta, they are going to bury it, right? People always like that placenta, though the hospital will always discard it when the woman gets pregnant, especially if the woman didn't carry the placenta home. But a lot of people carry their placenta and discard it, okay, by themselves. They bury it on the floor or something. But now there are a lot of things that is going on the medical ward. You can actually, the placenta can be made in such a way that people can eat their placenta. They do it in form of tablets. Okay, it has a lot of benefits in the body. That is a story for another day. But what we are asking today, Miss Stella Banaja, Nonshu, Pundit, and every other person that is watching, if you are a female and you have delivered a baby, comment on the comment section. Have you ever seen placenta before? Or did you deliver your placenta when you delivered the baby? Okay, so let us know. All right, so what we are talking about now is that the placenta attaches to the wall of the womb. Okay, so it connects the fetus by the umbilical cord. There's something that look like a cord that connects the fetus to the placenta. Okay, now this placenta always comes out after you have delivered the baby. 15 minutes or even less than 15 minutes after you have delivered the baby, this placenta will be also delivered. All right, but now In placenta previa, the placenta will be attached near or sometimes over the opening of the cervix. Okay? And this is what we call placenta previa. Now, if it covers, okay, you had 4 deliveries. Okay, somebody said she had 4 deliveries and she saw all of them. Yes, so this placenta is always there. You must deliver the placenta. If you did not deliver the placenta, they have to use evacuation method where the doctor will put hand and shred the placenta and make sure that not even one bit, because even just a little bit of the placenta that is retained in your uterus will cause a lot of infections. Okay, so when the placenta is delivered, the person that delivered that placenta is going to look at the placenta and make sure that every aspect of the placenta is delivered. Okay, that's why it is very, very important that you go to the hospital, because some people that deliver baby, when they deliver the baby, they will think, oh, we've delivered the baby, and they will leave, and the placenta will be in situ. Okay, all right. So now when you have placenta previa, this placenta will cover the cervical area, the opening of the womb where the baby comes out. Okay, and then as the baby is growing, the placenta is growing. So what it means is that if you have placenta previa, it's going to be growing and growing. So there are stages of placenta previa: stage 1, stage 2, stage 3. So it depends on the type that you have. There are some times you have placenta previa and actually the placenta is not covering the cervical area, and the doctor can still deliver this baby without any problem. But as far as you have been diagnosed that you have placenta previa, it is a contraindication to deliver vaginally. Okay? Because why? If you deliver vaginally, the fetus, that is the baby that is in your womb, is most likely going to tear the placenta. Okay, when the baby is coming out through the cervix, okay, into the birth canal, and it will cause a lot of very severe bleeding. Yes, you will have very severe bleeding that cannot be able to be stopped. So that's why it is a contraindication if you have placenta previa, just like Nurse Glory on Facebook just mentioned that she has placenta previa and she is going to have elective cesarean section. So now, what are the signs that a woman would say that will start pointing to the fact that she has placenta previa? Number one, if at 20 weeks of gestation, 20 weeks means 4 weeks is the first week, 8 weeks is the second week, 12 weeks is the third week, 16 weeks is the fourth week of of your pregnancy, right? 20 weeks is the fifth week of your 20 weeks is the fifth second trimester now. Okay, remember, 0 to 3 weeks is the first trimester. 1 week to 4 weeks is the first trimester. Okay, so now on 20 weeks of gestation, that is your second trimester, you now start seeing painless bleeding coming off from the vaginal area. Immediately a woman sees a spot or a bleed, and it's not as if you had any trauma or anything. Begin to start thinking, oh, what is wrong with me? Don't just look away, because it's painless, so you feel like, oh, it's a simple thing, and then you go away minding your business. No, that is the time you are going to be worried, and this bleeding that is painless can even worsen as the pregnancy progresses. So first trimester has gone, you didn't see any bleeding, and then second trimester, 20 weeks gestation, they tell you that, or not, they tell you, you go maybe use the restroom, and as you're cleaning out, you see a bright red painless bleeding from your vaginal area. that is a sign to show you that something is wrong. So you need to head to go see your OBGY or the team of doctors, or your or delivery expert that is having this pregnancy delivery. Okay, midwives are also people that also deliver, and babies, they are trained specifically to deliver babies. Okay, if your pregnancy is uneventful, there's no problem, you don't have any problem, or you're going to go to CS, like you don't have hypertension, you don't have diabetes and all that, why not? A midwife sees you and they would do the delivery and help you until you deliver your baby. Okay, so now you have seen this bleeding, it's coming and getting worse. You don't just keep quiet because it is painless. You will not think, okay, it might be messes. No, as far as there's a bleeding at 20 weeks of gestation, what it means is that probably the baby is now growing and there is a friction, or the baby is touching the placenta little by little. The baby is encased in the womb, right? Remember, there's something that look colorless, that the baby is inside, of course. And inside of that thing is what we call the fluid, where the baby swims. All right. So when this is rubbing on the placenta, that is what causes those small tiny bleedings that you are seeing. So you must head to your doctor and tell your doctor, oh doctor, I am actually seeing some bleeding which is painless. When I clean up after urinating, or even when I wear my pants, sometimes I have to put pad. It might not be as bad as that. It might just be a small bleeding that just come a little bit and go. Okay, so please, when you see this kind of bleeding, don't just say no, it's a normal thing, it's not anything to bother about. Go to your doctor. Just no harm in telling your doctor. And what is your doctor going to do? He's going to do some diagnosis. The doctor dare not put his hand, especially when you have said there is a bleeding. If the doctor do a vaginal examination, that finger can even rupture the placenta, which is already sitting at the opening of the birth canal. So the doctor will do what? Will do an ultrasound. And this will confirm, that ultrasound that the doctor does will confirm that there is a placental previa. Okay? Now, if this is so, there is absolutely nothing that can be done except cesarean section, because what the doctor is going, or the ultrasound is going to tell the doctor, is the type of placenta previa that the woman has. Okay, so having said that, you cannot deliver vaginally. Why will you not deliver vaginally? You can have what we call placenta abruptio. That is abrupt detachment of the placenta from the vaginal wall. Remember, I told you that the placenta will sit at the vaginal wall, right? So it is very, very important we all understand that when you have placenta previa, the only solution is delivery through cesarean section. Now, if this diagnosis of placenta previa is made and the stage or the type of placenta previa is known, what the doctor would do is what? Try and check if the lungs of this fetus is strong enough, because at 20 weeks the baby is still growing. So he's going to do some investigations to take the amniotic fluid, all right? And they will do some tests to make sure that, oh, is this baby's lungs developed enough to be delivered so that the baby can be able to breathe and nothing will happen. If they do that and there's a possibility that the lungs are not developed, the doctors will do what they know best to do. They will give a steroid for the lungs to develop so that the woman can actually deliver the baby at 36 weeks by elective cesarean section. That is the solution to placenta previa. The doctor will plan you, do the investigation what we call blood workup and make sure that everything is okay. Your blood is okay. You don't have blood pressure. You don't have diabetes. If you have, they will have to correct it. So from that 20 weeks that they've seen that bleeding and confirm that you have placenta previa, they are going to be monitoring you and then give you a shorter antenatal visits so that they will continuously monitor you regularly until the time when you will get to 36 weeks and elective cesarean section will be done. They will not allow you to go into labor because if a woman goes into labor, the woman will have the placenta abruption that I talked before, and that is just detachment of the placenta from the wall, and you will start having excessive bleeding that might not be controlled. That bleeding alone can even be the thing that will buy the woman that is in labor. Okay, now if you start bleeding extensively and it is getting severe before the 36 weeks that the doctor will do the cesarean section for you, you will be admitted in the hospital and managed. Okay, the reason why they are managing you is to give time for the baby's lungs to mature. Okay, but if the bleeding did not stop despite the bed rest that they have given you in the hospital, the doctor will not have any other option than to do a cesarean section and remove that baby so that the baby will be alive and you as the mother will also be alive. Okay, now if by the time they admit you in the hospital and you're bleeding, guys, have you shared this live? Because the more we share, the more we get more views and the more we make a lot of people to be very, very knowledgeable about this issue. Nasir Daudu, thank you for watching. Please share, 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 share. You guys need to share, send your emojis and continue to comment. Now, from all you have heard me discuss now, have you ever heard of any woman that had bleeding at 20 weeks? Comment on the comment section. Let me hear. Miss Stella, Noshu, Nasa, I can't even pronounce the names very well. I'm so sorry. Pardon me for that pronunciation if I didn't pronounce your name very well. Have you ever heard that a woman that is pregnant is bleeding? Comment on the comment section. Do you know anybody, your friends, your family, a distant person that you don't even know? Have you ever heard that before? Let's hear from you so that we will also understand whether you have heard that somebody had placenta previa. Okay? Now, if bleeding stops, remember I said you will be admitted in the hospital. So when you are admitted in the hospital, they will continue monitoring you and taking care of you. Oh, you've seen severally. Wow, that's so wonderful. So did they do cesarean section or did they deliver the baby vaginally? Madam Stella, the people that you saw that had bleeding in their vaginal area, when they went to the hospital, were they diagnosed that they have placenta previa or maybe other things? Because there are other things that can actually also cause bleeding. But what is specific about placenta previa is that the bleeding starts at 20 weeks gestation. Okay? All right. So if the bleeding stop by the time they give the woman a bed rest in the hospital, they will also tell you, okay, your bleeding has stopped, and then they can ask you to do what? Go home. Okay? And while you are home, you have to make sure you follow up with the admissions and follow-up visit, because every follow-up visit that you come, they are going to do, oh, it was miscarried. You see, I think probably they had an abortion. Abortion is not necessarily you go to the hospital and tell a person to remove the baby. No. Sometimes some bleedings can be as a result of different things, if there's some hormonal abnormalities and other things that can cause vaginal bleeding. But this particular one starts happening at 20 weeks. That is in your second trimester. You have passed the first trimester and then you're in the second trimester and then you start this bleeding. So you see, probably it might be placenta previa, probably it might be different thing that caused the bleeding. But whenever you are pregnant and you have a bleeding, it is very, very important that you go see your doctor so that your doctor will do the right thing for you and for the baby, and make sure that they stop whatever thing that is causing your problem so that your baby will continue growing in you, or if there is need for the baby to be removed. You see, the baby have to be removed and put in the NICU. Okay, the baby will be put in the NICU and continuous monitoring and treatment will continue until the baby is fit enough to go home. All right, now if the bleeding stops, you will be discharged and you go home and everything continues as it was, and you will continue going for your antenatal until you get to that 36 weeks. And 36 weeks is the time where the doctor will now go do the elective cesarean section and remove the baby so that you will be alive and your baby will be alive and everybody will be alive. All right. So with this being said, how okay, somebody said, I even saw a friend that the nurse mistakenly during delivery cut the placenta. Oh my God, that is a very serious problem. The doctor had to manually remove the placenta. Yes, I thank God that the doctor is knowledgeable enough, because guess what? If your placenta is cut and there is a tiny bit, as tiny as a mustard seed, that is in the womb that is not removed, that can be a focus for infection. So that is why that doctor went and manually removed the placenta. Okay, it is very, 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 very serious issue if your placenta is left in the womb when a woman is delivering a baby. So today, you have learned something new. You have learned about placenta previa. You have learned something very, very tangible. And I hope going forward, when somebody tell you that, oh, we have a bleeding while I'm pregnant, you're not going to tell the person, no, it's one of those things, don't worry about it, please. Any bleeding of whatever type, you must head to the hospital so that your team will do the right thing and correct that which need to be corrected. Okay, it is very, very salient for all of us to understand that today and make sure we do the right thing. Okay, very, very, very important. Oh, I didn't know what happened. Guys, I didn't know what happened. I think there was a loss in transmission. We are back. So do you have any question from what you have learned about placenta previa? So for all of us here now, we should pray for Nurse Glory. She is heavily pregnant and have been told that she has placenta previa. There's nothing like, oh, the villagers are at work or it's an arrow. You know, a lot of people have a lot of myth concerning pregnancies. Now that she is about to deliver her baby through cesarean section, it is very, very okay. You shouldn't say, oh, because she is delivering through cesarean section, she is not a woman. No, we should all stop all those African mentality of thinking that every person must be delivered through vaginal route. It doesn't work like that. Any way and anyhow you deliver your baby, that baby is precious. That baby is a baby that is delivered by you. Whether vaginally or cesarean section does not matter in delivering of a baby. that baby is wonderfully and beautifully made by God. So please, if there's any reason that you are going to deliver your baby through cesarean section, give yourself to the doctors. Tell them that you trust their judgment and you trust whatever thing they are doing, and deliver your baby and be at a good health status, so that you will also be able to take care of this baby that you have delivered and suckle your baby and take care of your baby. Let me tell you the truth. If you go right now, call a woman that have delivered via vaginal route and cesarean section, either way, that person is going to tell you they prefer the cesarean section. You know why? When you have your baby delivered through the vaginal route, your vaginal area is really very, very soft. So the possibility of some people being able to copulate and have sexual intercourse at that time is very, very, very slim. Some women, their pen threshold is very low that they won't be able to have that done. But for those that have cesarean section, immediately the wound heal and they are able to move about, they can start up their sexual exposure. They can have sex with their counterpart and their loved one without any problem. There are a lot of women that I know had vaginal delivery and they had what we call vaginal tear, and they did what we call heniography. They did what we call episciography. Sorry about that. When they suture that place where they had the tear, or sometimes they may have episciography done. So the doctor used the scissors and open up the vagina, the birth canal, so that they'll be able to deliver very well the vaginal area, right? And it is sutured. There are some people after that repair, they will be in severe pain. When I talk about pain, I mean severe pain, and they might not be able to have vaginal penetration. Okay, so what is important is you being okay, you being fine, and getting better. Okay, so please, guys, when you have any sort of pregnancy problems such as bleeding, it could be vaginal bleeding is as a result of placenta previa, it could be the vaginal bleeding is a result of other medical conditions. There are a lot of medical conditions that can cause bleeding in a pregnant woman. But what is, I said it before, I'm just hammering it again, what is very, very special about placenta previa is that bleeding comes at 20 weeks gestation. Okay, so at 20 weeks you start seeing bleeding that is painless. You did not hit your tummy anywhere, you did not have any sort of problems, but you just start seeing a tiny drip or stain of blood. Do not sit down and wish it away or say it is your mother-in-law, or some people even accuse their own husband. You see, that is what these people have put in our brains, and we have now believe that everything about our healthcare is an arrow from somewhere. It is somebody manipulating it from somewhere. This is the mental, picture that almost everybody have now. So, having said that, right now, when you have any sort of bleeding in pregnancy, or a woman that is complaining that, oh, I am seeing a sort of bleeding from my vaginal area, do not stop. Do not say, no, I'm not gonna do anything. Please advise the person to go to the hospital, and please make sure you follow suit and make sure that the person gets to the hospital and get the needed medical intervention and treatment that he or she needs for that pregnancy. So, Miss Ugochi, have you heard of any woman that have had any bleeding while pregnant? And have you ever heard even the topic that we are discussing, placenta previa? Have you ever heard it? Or have you ever seen a woman that came to you and said, oh, the doctor said I have placenta previa? All right, so this is what we discussed today, and I hope everybody that is watching this live from YouTube, from Facebook, because I am streaming in the two areas today. If you know somebody that need this video, that is currently pregnant, even if the person is not complaining of any bleeding, please send this video to the person so that the person will watch it and understand the importance of going to hospital and getting themselves checked out and making sure that they do the proper thing and not go to, I'm not saying prayers are not good. I am a Catholic. I believe in prayers, but you must definitely know that there is a big line, not thin, between religion and healthcare. Yes, pray, and definitely God is going to answer your prayers. Go to your pastors, let them pray for you, but please make sure you seek professional help by meeting the doctors, by meeting the midwife, by meeting the team that is taking care of your pregnancy. This is where we're going to end today's topic, and believing that I have been able to impart this knowledge and for you all to know that social media is very, very powerful. Can you imagine all these topics that I've been teaching every day? I pick them from the internet. So to tell you how much internet can impact on our body and our brain and our soul. It is not all about watching videos. You need to pick the bits and the right messages from whatever video you watch. Can you imagine when the buzz was about Blessing CEO and her counterpart was going on the Facebook? People were busy insulting themselves, but I picked child labor from it because child prostitution is a severe form of child labor. Okay, and I talked about it extensively, and I plead with you all now, if you have not shared this video and you have learned something, even if you have just learned that placenta previa is the placenta that is low lying and covering the vagina area and birth canal, please, that is something new that you have learned today. Use that reason to share this video out so that a lot of people out there will learn and do the right thing and make sure that they follow through with the medical treatment that they desire and deserve so that they will come out healthy. Because I have seen situations like this, the woman ended up either buying, or the baby that is in the womb, which is the fetus, will end up buying. How can a woman carry a pregnancy, suffer all these years, and then end up wouldn't see the baby that you have labored and suffered for the longest time to carry on your womb? So guys, go out there and make sure you pass the message. But before we go, have you shared this video? If you have not, please kindly click the share video. It is not going to make you spend more money for being on Facebook. Sharing is free. So please kindly comment on the comment section, like this video, send emojis, and make sure you share, please.